Pedal edema and CKD, causes, symptoms, and the treatment. Welcome to today's session on chronic kidney disease CKD. Today will be explored what pedal edema is and its causes, how it relates to the CKD, and best ways to manage it. First, let's see that the pedal edema is pedal edema is a condition where the extra fluid accumulates in the lower legs and feet, causing them to swell. This swelling can happen for several reasons, such as heart problems, liver issues, thyroid issues, kidney problems, or blood clots. Our body fluids are divided into two main areas: inside our cells and outside the cell. The outside area includes the space around our cells and inside our blood vessels. Edema or swelling occurs when there is problem with the how fluids are distributed between these two areas. The problem can happen if too much pressure builds up in the blood vessel, often due to heart issues or excess fluid, or it can occur if there are enough problems in the blood, like albumin, which help keep fluid in the vessels accidentally. Additionally, the lymphatic system normally helps to move the extra fluid and protein back into the blood, but if the system is not working properly, fluid can build up and cause swelling. The kidneys play a crucial role in requiring the body's fluid balance. The kidneys can remove waste and regulate fluid. When they are not functioning properly, fluid can accumulate, leading to edema, as seen in the CKD, AKI, or acute kidney infections, and nephrotic syndrome. Edema is one of the major symptoms of the CKD. Let's explore how clinicians approach to the diagnosis of edema and its causes. First, detailed history helps identify risk factors and underlying conditions like heart failure, kidney disease, and thyroid disorders. Edema can be generalized or localized. Generalized edema, this type affects the entire body or the large areas of the often linked to the conditions such as the heart failure or kidney disease. Localized edema type causes swelling in just one of the body areas. It is often due to inflammation, blocked lymph fluids flow, or issues with blood flow in the veins. During a physical, during a physical examination, clinicians look for pitting edema. The pitting edema is when there is indentation of the skin when the pressure is applied, indicating heart failure or nephrotic syndrome. Non-pitting edema suggests lymphatic obstruction or hypothyroidism. In case of the renal disease, the following lab tests and the imaging are helpful: CBC, renal function tests, including a serum creatinine, urine analysis, urine microalbuminuria, and urine albumin to creatinine ratio, as well as ultrasound of the abdomen and pelvis. A thorough history of the physical examination are key identifying system, causes, and specific signs guides the management plan. When it comes to managing edema, the approach depends on whether the cause is local or systemic. For local causes, non-pharmacological treatments are essential alongside addressing the underlying issues. For systemic causes, a combination of general measures and targeted treatments is needed. For local edema, non-pharmacological measures include limb elevation. Regularly elevating the affected limb helps reduce swelling. Then compression therapy, wearing compression stockings, can assist in improving blood flow and reducing the edema. Physiotherapy, massage, and other physical therapies should be performed by trained professionals. Ice applications useful for severe or congested edema and cases of cellulitis. Next. In cases where systemic causes are at play, such as in CKD, treatment features focuses on reducing fluid. retention and addressing the underlying condition. This involves salt restriction. Limiting the salt intake helps prevent fluid buildup and manage volume overload. Diuretics are indicated. The medication increase the urine output to help manage fluid levels. Uh, Different types include loop diuretics, that is furosemide and torsemide. Other preferred for the effectiveness and longer duration of action. Higher diuretics, example metolazone, used adjuvantly for enhanced diuretic effect. Potassium sparing diuretics, that is spironolactone, used cautiously due to the potential risk of hyperkalemia. The choice and the dose of diuretics depend on the factors like the severity of edema, the patient's hemodynamic status, and kidney functions. It is important to use diuretics cautiously and to avoid complications like hypokalemia, hypotension, and electrolyte imbalance. Regularly monitoring the fluid volume, urine output, blood pressure, weight, and periodic tests is essential. In chronic kidney disease, uh, managing edema often requires salt and fluid retention, essential to control fluid retention. High dose diuretics, loop diuretics like furosemide are usually effective, but thiazide diuretics can be added if necessary. Managing edema involves a tailored approach for local causes. Non-pharmacological methods are key, and systemic causes require dietary adjustment, diuretics, and close monitoring. Patient education is crucial. Understanding the condition, following the treatment plans, and making lifestyle changes can improve outcome. Early recognition and effective symptoms management help prevent complications. Join us in recognizing National Edema Awareness Day on September 25th to increase awareness and promote early detection of edema and related conditions. Together we can manage and understand edema better. Thanks for the watching.